Focus is brought to you by National Medical Stores, NMS, passionate about your life.
I want to hear your thoughts on how we have tackled the outbreak so far.
And I think a strength that we have is the fact that our systems are able to detect. And in the past, we've had a great track record with Ebola in terms of minimizing death, but this is a different strain. On the other hand, the last 2 years have really dealt a blow to the public's confidence in how government handles epidemics and pandemics. And part of why that has been a problem is just the state of our health system. Remember when the outbreak was declared, people were like, this is another money-making adventure. And that wasn't the attitude some years back. And I think it's just because of how COVID-19 was handled. And that's a challenge because public trust is very essential. Like, they need to believe you when it's an outbreak. And the other community structures you've put in place, first of all, well motivated, in terms of being facilitated, in terms of being trained to go and educate the community and report, but also do they have a proper sort of referral structure? Can they send people to where they can get help? These are all things the government should be proactively thinking about when the cases are not haven't overwhelmed the system yet.
At the point of healthcare workers is where I want us to focus now, because we were through COVID-19 and we saw the challenges with their allowances and availability of PPE. And these are still the same things.
I think also the fact that we have failed to prioritize the well-being of our healthcare workers. When COVID-19 showed us that at the end of the day, it's going to be people that are willing to do what's necessary to get you through it, and healthcare workers and the frontline workers, they are our heroes, and we keep having heroes in health awards and everything, but are yet to actually translate it. Why are we even having conversations about whether they have enough protective equipment? Remember when they were like, we're not sure. And why did the medical association have to get a point where it cautions its members and says, if you don't have personal protective equipment, do not go in there? It's because they have seen what has happened. But why do we remain in this cycle of failing to really prioritize and care for health workers, make sure they're well remunerated, make sure they're well protected, and make sure our health systems are supporting them? Because if they are well remunerated and well protected, if you have a health system where you're lacking basics in health facilities, or where they're not close enough the population, and you're continuously getting people who are presenting too late for you to save them, even the most heroic, motivated healthcare worker would not thrive in that environment, and patients would not be saved.
We have an advantage that Ebola is not entirely new in Africa, even here in Uganda. This is the 5th time, at least according to the Ministry of Health, that we've had Ebola in the country. Should we just rely on that piece of information as an upper hand in the way the community relates or reacts to prevention, for example, or helping to contain the disease?
When it first came out, everyone was like, oh my God, Ebola. And people were sort of self-doing it, right? And then the government came into a lay fears. We won't close, we won't do this, which I think was good from an economic perspective. But then the other side was like, oh, we've had it. We know how to deal with it. And a part of me wonders, do you truly know how to deal with it? Because this is a new strain. So I think government has that tricky balance in messaging about to reassure you for the economy to go on and so forth, but also to make sure that it is given the seriousness it deserves in terms of preventative measures. And I think another part of it is people will be more willing to do this again, like I see, if they see government playing their part, right? And making sure that the failures we saw with COVID-19, fixing the health system, accounting for any funds or anything that happens, those issues that really eroded public trust, if government could begin to take them seriously and begin to proactively get ahead of them.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store, and distribute essential medicine and medical supplies to all government health facilities in Uganda.